When you started your journey as a doctor in the Indian Army, what kind of cases you dealt with, and if there were any peculiar or interesting cases that you have had?
Wow, that's a very big question. I have to cover 40 years, my span of armed forces service. Well, I joined as a lieutenant and I superannuated as a lieutenant general. Lakhs and lakhs of patients I have seen. But I think what gave me the greatest satisfaction or happiness is to rehabilitate the patients who have been injured during the combat or non-combat injuries, people who have suffered facial trauma, people who needed help because of loss of some organ on the face, or they lost their teeth or they lost half of their jaw. So rehabilitating maxillofacial trauma was one of the best. And of course, making our soldiers fit and making them fit for war, and then treating the families and the troops and everyone, I think it was very, very satisfying.
You also have been treating the presidents of India, so would you like to talk about that?
Well, I think I was very fortunate that they chose me as their dentist, because obviously when somebody of that stature comes to you, I think it's a very big honor. I think I was very lucky that I have treated our president, Dr. Abdul Kalam, a lot, also Dr. Pranab Mukherjee, and a lot many other bigwigs. But what probably makes them stand apart was the simplicity and the nicety with which they treated the doctor. Like I remember having talked to Dr. Abdul Kalam first time, so I was more nervous when I was talking to him for the first time. And he had this, childlike simplicity, a very simple childlike curiosity about everything what I am going to do. And he always, whenever he left me, he left, definitely with some kind of a message which has stood me very good in my life. I have very deep regards for Dr. Abdul Kalam. It was, I think it gave me very, very different kind of lessons in my life.
Rakesh Sharma was being sent to the space and you were in the board. There was also some sort of debate that happened with the wisdom tooth extraction. What was that all about?
Yeah, that was a very interesting scenario. I was young at Bangalore Air Force Dental Unit at that time, AFCD as we call it. And we had these, Indian astronauts who were supposed to go to the moon along with the team of Russians. And the medicals were going on at that time. And I distinctly remember Rakesh Sharma and, Ravish Malhotra, both of these were shortlisted. And one was supposed to go, finally. And their dental checkups were done, and we were told that their wisdom teeth have to be taken out. So we were fighting with them, but that they are perfectly fine. Why you want to take out their wisdom teeth, Because they're perfectly aligned and they are not going to cause any trouble. But then it was very clear by the Russians and the dentists from there that no wisdom teeth, because the trip cannot be cancelled or trip can't be called back. So he told me, Doc, wisdom tooth goes away. So that was a different lesson at that time when we learned that yes, a wisdom tooth can create a problem anytime. And then of course after that we developed a lot more in this, because at that time the first intraoral full mouth X-ray machine was imported by the Air Force Central Dental Establishment in Bangalore during that year. So it's a very good memories of that.
How dentistry in general has changed over the course of time? And you have been here for 40 years, so you must have seen a lot of changes.
Yes, I think dentistry has changed unimaginably. And I'll say the amount of technology which has been inducted or which has been introduced in the dental, I don't think any other, any other branch of medicine can boast of that. To some extent, but unlike dentistry. Like when I joined, we used to, do work on foot engine, which used to be operated by foot. And I think we could achieve a maximum of 1200 revolutions per minute. So drilling was very, very cumbersome. Also very harrowing experience for the patients also. From there, we have moved today to air rotors having RPM of something like 12 lakhs, and from 1200 to 12 lakhs is something very big change. Dentistry has changed in materials, in technology, armamentarium, the new recent trends which are coming every day. I think dentistry has completely metamorphosed into now a science which is today creating beautiful rehabilitations. It is creating unimaginable, preventive measures, and also, we are generating smiles, which we are very proud of. I would like to touch upon two very strong points here, which have come up in dentistry, which are going to change it further. Like if we look at it today, the new technology has come in whereby we can scan the oral cavity. That means we are not going to take impressions, which we used to take normally. The massive tray, and you fill it up with material and you put it in patient's mouth and patients are feeling, gaggy. Those things are gone. Now you have a scanner, which is nothing, which is not a radiographic, which is not any radiation. It's a pictorial graphical scenario of your oral cavity, which comes on your screen. So you just scan the oral cavity and the whole mouth is reconstituted or reproduced on a screen. Then you can manipulate it, you can adjust it, and based on that, you can create a model out of it. So those days are gone when one had to rely on impressions. Today you can just take a scan and you come out with a beautiful model, and on that model you can do anything. You can make artificial dentures, you can plan your beautiful smiles on that, you can make your bridges on that, you can make implants on that, you can also correct irregular teeth with the help of making aligners on that. So that is one very big breakthrough in dentistry. And I think the second breakthrough which has happened is in terms of replacement of teeth using the implantology, because now we can give fixed teeth to people, and we know that the young people are losing teeth at a much younger age today than probably the people like us, and we have to rehabilitate them, we have to bring them back to function, we have to give them their smile back. Their implantology is proving to be one of the best tools for us to rehabilitate.
And so would that be correct to say that what people associated before, that dentistry and pain, it's no longer the same thing anymore?
Yeah, the apprehensions of dentistry is still very much there in people's mind. It's very much there. But I think those who have come for treatment, they realize that now there are hardly any pain, because we have new lasers which have come in. So that means we can actually do without drilling a tooth, we can do fillings without drilling. Then we have atraumatic restorations. That means you have fillings which can bond to the surface of tooth. So you don't have to drill and fill. Rather, you can do a bonding fillings which are tooth colored and which are better. And then over a period of time, at least when I was in army, I'm also very proud to tell you that in 2014, we eradicated the mercury and the silver amalgam completely from the armed forces. So we made army mercury free. And we all know that mercury toxicity is in itself a very big problem for the whole of the world. And now that I'm heading Clove Dental, all 600 of our clinics are mercury free. We don't use silver fillings at all anywhere. So dentistry has changed completely. Apprehensions exist, but pain do not. And that is very important to know.
So now coming to some technical questions about dentistry, about oral health in general. What I want to know is, are there any specific oral bacteria that have been linked to chronic diseases or conditions outside your mouth?
Yes, over a period of time, scientific evidence exists today and very well documented in the best of the medical journals that if you have a pre-existing systemic disease, your poor dental conditions can worsen it. Like, for example, if you're suffering from diabetes, and if you have gum infection, your diabetes will not be well controlled. This is proven fact. Rather, it will worsen. Similarly, if you have a very poor gum condition or you have infection in your mouth, you can have it worsening your cardiac problem. If you have a predisposing factor, this will worsen it. If you have any kind of disease in the body, and if you have an oral condition which is having some infection in your gums or teeth, it will worsen that. So these are well proven. This is also well proven that if you are suffering from chronic generalized periodontitis or even gingivitis, which means very poor gum health, and if you are a mother to be, if you're pregnant, you may have a low birth weight baby or you may have a preterm baby. It is that serious. That is why we advise all ladies who are going through this that please get your teeth checked and make sure that you have no infection in your mouth, because that will be very, very expensive to your child. So these are some of the known factors. In addition, I think any and every systemic disease today, it is known that if you have a dental problems, you will have worsening of the existing systemic disease.
And so there's also a saying that a tongue can tell a lot about your health. How does it happen?
I'm very happy that you asked, because mostly I think tongue is a very neglected organ today. We talk about it. But tongue is the true mirror of our oral health, because the color of the tongue tells us if you are having any deficiency of very essential minerals or vitamins, or very, very essential scenario. Or if the tongue is changing its color, then also we understand that probably you have a systemic disorder. If your tongue has different kind of coating, it tells us what kind of systemic problems you are facing. Tongue often shows the first sign of systemic disease, and we don't look at it. But as a dentist, we are trained, and many times we tell the patient that, have you got your blood investigation done? He said, why? We said, I am seeing some telltale signs in your body. I think you are having some deficiency, or I think you have probably a diabetes in the making, or maybe you have just got up from some viral disease. We can tell you up to that level, because mirror of the whole body is your oral cavity, and we see it there.
Talking about, the oral health in general, dry mouth, how does that contribute to dental issues or issues in general?
It is now better understood. You see, many times I am asked by young parents that I am brushing my kid twice, but still he has got a dental decay. Why? So we tell him maybe, he is having a sweetened milk which is pooling in his mouth, which is causing probably, baby decay, or all the teeth are getting decayed. So that may be the reason. They said, no, we are not doing this. One thing which many of our dentist friends are also missing, that is he sleeping with his mouth open? If he is sleeping with his mouth open, then he will have a dry mouth. If you have a dry mouth, that means you are definitely going to have more and more of decay. The saliva, what is in our mouth, it protects us against the decay and against the infection and the gum disease. This is a well-established known fact for hundreds of years. But the true implication of this in relation to the oral disease has not been studied that well. But during the COVID time, we have realized the importance of saliva, and we have also realized that a lot of diseases we can diagnose today from saliva itself. That is why many tests are being worked out which you can check from the saliva. So dry mouth is a condition where your saliva is either deficient or ropey or thick, and it is insufficient to keep your mouth warm, wet, moist, so that it is well covered. Now look at people who have, some hormonal disturbances or hormonal changes, especially in ladies, during pregnancy, during menopause. Also people who are diabetic, people who are smokers, or people who are on a medication for some, larger disease like cancers or, other diseases. They have very severe dry mouth and their oral conditions are in a terrible shape. But if they take precautions and take certain silogogues which induce saliva, or some toothpaste which induce saliva, these can be protected. So I'm very happy that you have asked a very pertinent question, which I don't think has been asked from me at least by anyone.
And sir, you mentioned about how one sleeps also tells a lot about and has to do a lot about oral health and dental health. Sleep apnea is one of those disorders where you sleep with the mouth open.
Yeah.
So how does a dentist then play a role in managing that condition?
This is something which is not very well understood by many. And more sleep studies are being conducted by specialists who have devoted their career toward these. And these are something where a dentist can positively help by repositioning of the jaw. So patients who are diagnosed with sleep apnea, they have a lot of sufferings which they cannot diagnose, or many of the medical practitioners cannot diagnose them unless they are with the right person. And then he says, oh, you have sleep apnea. If we correct your sleep pattern, you will be free from all these other body diseases. And there a dentist can help a lot, because we can reposition his jaw slightly further, opening up the air passages. So sleep apnea is reduced a lot. And many of the people are using machines for sleeping. And if we can handle his jaw by just inserting an appliance a shade forward, we can create that sleep apnea problem to go away. And this is something which many of the dentists are now practicing very well.
Dental health is something that it's a basic thing we learn at home. But that is why there are also a lot of myths around it. I'd have a few myths with me at this point, so I'll just throw a myth at you and you can just tell me if there's any base or not. The first one is sugar is the only cause of cavity.
No, sugar is not the only cause of cavity, but it is. Like I just told you, if you are having your normal sugar, and before sleeping, if you are brushing your tooth, or if you're not brushed, you even rinse or gargle very well, I think it's very good. I don't think I'll agree to this.
Overbrushing is not a thing.
Overbrushing is definitely a wrong thing. Our teeth need gentle scrubbing. What are you trying to remove from the tooth? We are trying to remove a slimy layer on which certain food particles or the layer of food along with germs are there. We call it plaque, which is a slimy layer which is deposited on the teeth. Over a period of time, it gets hardened. You're only trying to remove that. That means you need gentle scrubbing of your teeth. You don't need super hard brushes. You need super soft. You need a super soft brush, and rub your teeth gently. They're your own. They're not your enemies. Take care, because more you rub your teeth, you're letting go of your enamel. And enamel once gone can never come back. The skin can come back, enamel cannot. Remember that. Enamel once gone doesn't come back. And it's the hardest substance in the body. Still, brushing can take it away. So use a super soft brush. Wet your brush before you use it. Gentle brushing all the teeth, every place, and I think you're done.
If your teeth don't hurt, you don't need to go to a dentist.
I think I'll say that you must visit a dentist. Not that I am a dentist. You must visit a dentist, and dentist should be a friend, you see. Don't go to him as a doctor. Don't get scared. Go to him, take his advice, use your own mind, and then decide what are you going to do. Because what happens is at least 40% of our teeth area are such which you cannot see. So I always advise my friends and everyone else that please examine your own teeth in good sunlight. Look at your teeth with the help of a mirror. If you find there is a change of color, discoloration, redness, or any change, must go to a dentist. Because you can find out yourself. Even if you are not a dentist, you will find, oh, it's not pink, it's red. Or you will find, oh, my tooth is not white, it's brown or black. Visit. See your cheek also. If your cheek has some strands or some fibrous, you understand that there are some changes taking place. Maybe that is because of the pan masala or tobacco or some, maybe a traumatic bite that is causing damage in your cheek, and you will have to be very careful because these days precancerous lesions go unnoticed. So that is why I say examine your oral cavity positively every month once in a good daylight. That's all.
And so the last myth is white teeth are always healthy teeth.
Every one of us want white teeth, but teeth are something which are given to you, genetically. You can't make your teeth white unless you come to a dentist. But teeth, what color you inherit is from your parents. See, the tooth shape, size and color you inherit. And of course, whiter the teeth, the better they look. And we get a lot of people who come to us saying that please make our teeth white. If they have a developmental problem, yes, we definitely make them white. But otherwise, you cannot whiten a tooth.
Since you have been a doctor in the Indian Army and now it's a different sphere altogether, what differences do you see now versus then?
Well, I'm completing now 10 years outside Army after my superannuation. And when I came to Clove Dental, we were something like 26 clinics. And today, just yesterday, we inaugurated our 600th clinic. We see something like 50,000 patients every month in our clinics. And that's a huge, huge number. 50,000 patients, and where we are doing the most recent and most advanced dental surgeries, be it very conventional, that is the routine dentistry, that is fillings, scaling, polishings, and your normal preventive maintenance, or we do some rehabilitative where we are doing crown and bridges and we are making people, functionally better and their speech better, or we are fitting implants in patients where people say that, other practitioners say that, no, we can't fit an implant. We say, okay, come to us. We'll give you an implant because we can make your bone augmented, and we can give you implants for permanent fixed teeth which you don't have to remove. Or if it is an advanced surgery, which is a planned surgery or which is for a disease, or if it is treatment of irregular teeth where we are using aligners which are invisible. And you will be surprised that if you're sitting next to somebody, you can't make out that they are wearing aligners. Compare it with the, clips or braces or brackets or springs or elastics which you used to have on your teeth, and compare it now to aligner, which you can't even see. That means if you are a working girl or if you are, in social life somewhere, you can wear it and nobody knows, and your teeth start getting corrected. Or if I still move further, then I will say the prevention of the oral cancer or the white lesions or other lesions of the mouth, on which we do very active work, because 50,000 is a huge, huge sample. Now the best part of this is all our records of the patient are documented and available to us digitally. Let me share with you, I have something like 25,000 running patients whose irregular teeth we are correcting. And if you ask me, doctor, do you know which patient is at which stage of treatment and how much more? I can tell you up to the last patient. That is the technology what we have. If you ask me, doctor, you have a clinic in Vizag, do you think the sterilization of that clinic is being maintained as you want? I will say yes, because we are using artificial intelligence in which our clinic camera can actually see whether the dental assistant has carried out the complete asepsis of the surgery or not. And secondly, the screen in front of the patient will turn green once the clinic has been done asepto. These are some of the technologies which are not there even in the best of the advanced countries also. Many of our foreigners, when they come here and they see our use of artificial intelligence in maintaining the hygiene, sterilization, asepsis of the surgery, कि आप ensure कर रहे हैं that you are making a sure of it that your surgery is clean before the next patient sits. They got a shock. They said, even we don't use this. And all my clinics are using digital x-rays, digital records, and our digital call-up. We also store patients' all data, pictures pre-operative, post-operative, x-rays pre-operative, post-operative, as well as the patient's consents. I think today in technology, we are very advanced as far as not India is concerned, but as far as the world is concerned.
What is the one piece of advice you wish more people followed?
So I'll say that friends, remember that today only brushing is not going to be enough. You need more cleaning aids for you because you're eating soft food, you're eating pizzas, you're eating burgers, everything is sticking to your teeth. So use a soft brush twice. If you cannot brush, rinse. You must definitely use a dental floss. Many of you, those who don't know how to use a dental floss, look at the YouTube. All of you know how to do a dental floss. If you are 35 years plus, use interdental brush because 40% of your teeth you cannot clean with brush. 40% of the tooth surface can be only cleaned either with a floss or interdental brush. I won't mind if you want to use a mouthwash, but I will say that don't take alcohol based because mouthwashes are also good. They also help you maintain your oral hygiene to the best. And my last version in that is don't use the same toothpaste again. Keep changing your toothpaste because every toothpaste manufacturer adds something new in their toothpaste so that they have a better effect. Many toothpaste are, anti-sensitivity. Many toothpaste are, against dry mouth. Many toothpaste are very conventional. Many toothpaste contain a lot of herbal ingredients. I will say I don't mind if you keep 2 or 3 toothpaste in your on top of your sink and maybe keep changing. I think that's what I will advise you to look after your teeth with. Thank you very much and Jai Hind to you.